Hi, I'm Jim Zaslowski. A lot of you guys know me as Dr. Z. I work at First State Spine, and we take care of a lot of necks at First State Spine. And I'm here to just talk about the neck or the cervical spine and some of the anatomy associated with the cervical spine. We're going to do a couple segments about just some general education about the cervical spine, anatomy, injuries, and treatments of it over the next couple weeks. So we wanted to start to talk about some of the anatomy, and I have a little model here that we're going to go over. And basically, the cervical spine consists of 7 bones and discs in between. The discs are like jelly donuts, and what the discs do is act as shock absorbers between the bones and prevent the bones from rubbing on each other, and they also hold a space open for the nerve to come out. The nerves come out the side. In this model, the nerves are cut, but in real life, these nerves go down our arms. They start up in our neck and come all the way down our arms. Each of these nerves is numbered, and by the number of the nerve, we know where that nerve goes in the body. So this nerve would go over into the front of your shoulder. A nerve lower down here goes all the way into your hand and could affect the fingers on the outside of your hand. And it's kind of like the wiring in a house. You know how a house is wired, and if somebody trips one of the breakers because they're blow drying their hair too long, then you know exactly where to go to the breaker box, flick the switch back, and poof, lights come back on. Same is true in the cervical spine. Based on where a patient comes in with symptoms, we know exactly where to look for in the cervical spine for an injury or a herniation that could be squeezing a nerve. A lot of people don't understand that most neck pain and neck problems present as arm pain. They present as pain that radiates down the path of one of these nerves, and you get mostly symptoms in your arm, mostly numbness or tingling in your hands, weakness with your grip, trouble lifting your arm in certain positions, and even weakness up into your shoulder area. That could be more symptomatic or more effective to your lifestyle than the actual neck pain you get with a neck injury. So various problems with the discs in your neck present as arm pain rather than neck pain, which is why when we hear a patient coming in with numbness, tingling in your arm, in your hand, weakness in the grip, trouble with opening water bottles or jars or lifting things or pushing doors open or even pushing themselves out of a chair, we look to the neck as possible solutions. Thus, that's going to conclude some of the anatomy that we're going to talk about for the cervical spine. We're going to follow up with some common injuries to the discs and how they put pressure on the nerves and causing the arm pain, causing the numbness and tingling that we have described in our next segment. Thank you.